A very good afternoon to all the viewers. I'm Dr. Deepa N. I'm a consultant gynecologist at Apollo Spectra Hospital in Chennai. So today we are going to take a very common topic called fibroids. And we see quite a few women coming with the complaints of fibroids. And there are various questions which have been sent to us and asked to us in the clinic by all our patients. And I have taken a few questions which I will be answering for you. Now, the commonest question is in your mind would be, what is a fibroid? Fibroid is just a thickening of the muscle layer of the uterus, which is the middle layer. And the fibroid can be of various types. It is sometimes called as intramural or subserosal or submucosal fibroid, depending upon its location. Another common question which we get is this cancer? Fibroids are just a thickening of the muscle, and the chance of it converting into cancer is very, very less than 1%. Only when there are huge fibroids, sometimes which have been present for a long time, then there can be a tendency for it to convert into a cancer. Now, the other question is, does all fibroids create problem? Not necessarily. There are many people who don't even know they've had a fibroid. Sometimes it can be as big as a melon or a football size, and they wouldn't even know they've had a fibroid until somebody sees them and tells them, look, you have a big mass in your tummy. Now, then how will the patient know whether they've got a fibroid? Sometimes some people can present with difficulty in conceiving, and they present to the doctor with a history of trying to conceive and inability to conceive. And that's the first time when we do a scan, we will be able to find out that they have mass in their uterus, and the diagnosis of fibroid is made. Sometimes people can present with a very heavy bleeding, or other times it can be a pressure symptoms like fibroid in the front wall of the uterus can press on your bladder. Fibroid which is present in the back wall can present on the back passage, which is the rectum, and can give rise to constipation. And sometimes they can have very heavy bleeding or difficulty in passing urine, or a feeling of incomplete emptying of their bowel. And these are the times they will present with these symptoms. And then when they come to the doctor, the first thing we will do is examine them, see if there is something very obvious. If nothing is very obvious on examination, then we do an investigation called an ultrasound scan. Ultrasound scan is a simple scan, which first we will do a abdominal scan where we scan through the abdomen, and then also it has to be followed up by a vaginal scan, so which will give a much closer look at the uterus and give us more details about the fibroid. So once we confirm the diagnosis by the scan, sometimes some patients may also require further scans like an MRI scan. That is, if the fibroid is very big and if we think there are too many fibroids, when we need to correctly map the fibroid, and if it is too big and it's not easily mapped by an ultrasound scan, then we will require an MRI scan. MRI will also tell us whether this fibroid is pressing on the urine tubes called the ureters, or whether the fibroid is, the number of the fibroids, the location of the fibroids, and the size of the fibroids can be very clearly made out by an MRI scan. And this we usually do prior to surgery, which will help us in correctly, choosing the correct method of surgery which we need to do. The other question which we get is, how do we investigate the fibroids, which I just told you, either by a scan and if necessary an MRI scan. Then do we need to treat all fibroids is a question which many people ask. Not everybody with a fibroid needs to be treated. Suppose a woman comes to us and has a very small fibroid, which is about 3 centimeters, which is sitting in the muzzle of her uterus. She doesn't have any symptoms like heavy bleeding or any pressure symptoms or any difficulty in conceiving. Then we don't go ahead and treat this fibroid. We just leave it alone. We follow the woman up every year with a scan to see whether this fibroid is increasing in size or not. Even if there is a 4 or 5 centimeter fibroid, and if the woman is way past 40 or 45 years of age, and if she's got no symptoms, if it's not bothering her in any way, then this fibroid just needs to be followed up and it need not be treated. The other question which we get is, what are the types of treatment which is available for fibroid? As I told you, not all fibroids need to be treated. And there is a medicine which is available, which is currently used by some of the gynecologists. I personally do not use that medicine to shrink the fibroids because it does seem to have some kind of side effects on the kidney function. So personally, I don't use this medicine which is available to treat the fibroids. Then there are other injections which can be given, which will slightly shrink the size of the fibroid. That is used only when we want to shrink the size of the fibroid just before we plan a surgery. The other more treatment modes which are available is, there is something called uterine artery embolization, which is the fibroid is, the size of the fibroid and the growth of the fibroid is dependent on a hormone called estrogen. And also the fibroid gets its blood supply from the blood supply which comes to the uterus, which is called as uterine artery. Now, what we do is we block the arteries which are supplying which is supplying the uterus, and hence the blood supply to the fibroid is slightly decreased, and which will help in shrinking the fibroid. Now, this kind of modality used to be popular, and the unfortunate thing is it cannot be used for a uterus which has got like 5 6 fibroids. If there is one single fibroid, and if this fibroid is not too big, then maybe we can consider this treatment called uterine artery embolization, which will help in shrinking this fibroid. The other treatment which came in a few years ago is called as MR focused ultrasound, where the woman lies down on a table, head facing downwards, and MR focused ultrasound is delivered targeted at this fibroid. But this treatment can take sometimes 5 to 6 hours or sometimes longer, and one single sitting might not be enough to shrink the fibroid. We might have to do 4 or 5 sittings, and then this will help to shrink the fibroid. Now, this is not a very popular method, and the facilities is not available everywhere, and it's fallen out of vogue now, and not many people opt for this kind of treatment. The other commonest treatment is surgery. Now, do we recommend surgery for everyone? As I told you, not everyone requires a surgery. If the fibroid is very big, or if the fibroid is causing excessive bleeding, making the woman anemic, or if the fibroid is very big and pressing forward on the bladder, causing difficulty in passing urine, or frequency in passing urine, or the woman feels that she is not emptying her bladder completely, she feels like there is incomplete emptying, then she comes back and then again feels like emptying her bladder. Or if the fibroid is on the back wall and if it's big and it's pressing on your back passage, causing constipation or a feeling of incomplete emptying, or if the fibroid is sitting inside the cavity of the uterus or pressing on the lining of the uterus, causing excessive bleeding or difficulty in conceiving, then these fibroids definitely need to be treated. And surgically, we have two options. Previously, we used to do only an open surgery, and it is called as laparotomy, and myomectomy, or removal of the uterus, called hysterectomy. If the woman has completed her family, we would recommend removal of the uterus so that the problem does not come back once again. But if the woman is aspiring for a baby, has not completed her family, then we would recommend only removing the fibroid, which is called as myomectomy. Previously, it used to be only open surgery. Now we do laparoscopic surgery for both just removal of the fibroid, which is laparoscopic myomectomy, or for removal of the uterus, which is called as a laparoscopic hysterectomy. If it is very large uterus, almost extending up to the ribs, then it is better to go for an open surgery. But anything almost up to the umbilicus can be operated laparoscopically. That also depends upon how comfortable your doctor is, how skilled your doctor is to do this surgery laparoscopically. Then the question which we get is, what is a submucous fibroid? Now, fibroid, as I told you, comes from the muscular layer of the uterus. And if this fibroid is more towards the inner lining of the uterus, jutting into the lining of the uterus, either like a small ball or like a lemon in the cavity of the uterus, then that is called as a submucous fibroid. These fibroids usually give a lot of problems. Women will complain of severe dragging pain during their periods and excessive bleeding, making them anemic, and definitely it will cause difficulty in conceiving. Now, these fibroids, if it is very small and if the woman is not had a baby yet, we remove it vaginally, passing a camera through the vagina. It is called as hysteroscopic surgery, and we remove only the fibroid. If the woman is older, if she has completed her family, we recommend removing of the uterus, called hysterectomy. Then the other question we get is, can you conceive after removal of this fibroid? Of course, you can conceive after the fibroid is removed. You need to give yourself at least 2 to 3 months time for the uterus to heal and all the stitches in the uterus to heal, and after which you can definitely try for a pregnancy. Can you exercise following the surgery? Yes, certainly you can. Again, you need 2 months time for your uterus to recover and for your wound to heal, and definitely you can start exercising. And the other question which women ask is, can you have a normal delivery after a fibroid surgery? If you've had a submucous fibroid, which is a fibroid which has been removed vaginally, then definitely you can have a normal delivery. But if you've had a big fibroid which required a laparoscopic surgery, making a cut on the outer wall of the uterus, then definitely you can conceive, but you will definitely need a cesarean section following your surgery. Then the other thing which women have asked is, can fibroid convert to cancer? As I told you in the very beginning itself, fibroid converting to cancer is very low percentage, less than 1% chance. But an MRI scan, when we do, will also reveal to us whether there are any cancerous changes which are seen in this fibroid. So I hope I have covered quite a bit about fibroids. If you have any questions, you can keep them coming. So I have a question which says, what are the signs of fibroids breaking down? Um, Sometimes during pregnancy, the fibroids can grow bigger. It is called as fibroids will grow bigger under the effect of the estrogen hormones during pregnancy. Sometimes during pregnancy, it can undergo a red degeneration where the fibroid will become slightly squishy, and it can give rise to fever and severe pain. And this is called as a fibroid breaking down during pregnancy. And this is called as red degeneration of the fibroid. We don't need to do anything. All we need to do is pain management and give paracetamol for the pain, and then symptoms should settle down. Can you feel the fibroids move in your stomach is the next question. Yes, sometimes if it is very big. In fact, one of my receptionists came to me and said, I feel like a football moving inside my stomach. When I had a feel of her tummy, she had really a football sized fibroid, which was moving from this side and that to that side, especially when it is on a stalk. If it is coming right from the uterus with a big base, it will not move about. But if it is on a stalk, like an apple or something hanging, you will feel it moving around. Then, which size of the fibroid is dangerous? Any size of the fibroid can be dangerous depending upon the location. If it is causing very heavy bleeding, making you anemic, even it could be just 2 or 3 centimeter size, that could be making you really weak and anemic. That is also bad. Sometimes it can be very big, causing pressure symptoms. That is also bad. So it really is not the size of the fibroid, it is how much trouble it is causing you. What triggers fibroid growth? Fibroid growth is triggered by the estrogen hormones. And once you hit menopause, once your periods completely stop, once your estrogen hormones come down, then the fibroid, if it is too big, maybe it can shrink a few centimeters. It will not completely disappear, but it will only shrink by a few centimeters. How can I permanently cure fibroids? You can permanently cure fibroids by completely removing your uterus. As long as you have uterus, as long as you're prone to develop fibroids, you can keep getting fibroids again and again, even if we remove the fibroid alone. Can the fibroid grow very quickly? If it is growing very quickly, that is not good news. That means it is converting to cancer. And usually fibroids take a few years to grow bigger in size. Can any food destroy fibroids? I do not know of any food which can destroy fibroids. When should you worry about fibroids? You should worry about fibroids if it is causing excessive bleeding and making you anemic, or causing severe pressure symptoms like difficulty in passing urine, incomplete emptying, or difficulty in passing motion, or incomplete emptying of your bowel. Who does fibroid affect the most? Fibroids, anybody can get fibroids, more common in Asians and Africans. And which size? What organs do fibroids affect? Fibroid mainly affects the uterus. I am talking about uterine fibroids. Wherever there is fibrous tissue in your body, you can get fibrous swellings, like you can get a fibroadenoma in the breast, you can get a fibroma in the skin. Wherever there is fibrous tissue, you can get fibroid. But what we are talking today is uterine fibroids, because I'm a gynecologist and so we are sticking to the uterus. Who does fibroid affect the most? Yes, Asians, Africans. Which size of fibroids need surgery? It can be any size. If it is causing trouble, it needs to come out. What foods, how can I permanently cure? What are the severe symptoms of fibroids? Severe symptoms of fibroids are heavy bleeding, excessive bleeding, like you're changing 8 to 10 pads in a day, or you're passing heavy clots, making you anemic. Or if it is causing severe pressure symptoms, then those are the severe symptoms. What if the fibroids are not removed? All fibroids need not be removed. If the fibroid is not causing you any trouble, and if the fibroid is small, it need not be removed. You can just follow it up once a year with an ultrasound scan. But if the fibroids are causing you trouble, then it definitely needs to come out. What are the stages of a fibroid? Um, there are no stages of a fibroid. There's only types of the fibroid, and there is the growth of the fibroid. And what are the signs of early stage of fibroid? Unfortunately, you do not have any signs of early stage of a fibroid. Most people wouldn't even know. Like, for instance, I had fibroids. I never knew that I had a fibroid. I had a 4 to 5 centimeter size fibroid. It never troubled me until I went for a scan. It was an incidental finding on the scan. I never knew I had a fibroid. Do fibroids make you gassy? Not necessarily, unless it is pressing on your bowel. It can make you feel very gassy. How long is fibroid surgery and the recovery? Fibroid surgery can take anywhere between 1 hour to 3 hours, depending upon the size, the number, and the difficulty of the surgery. And if it is a laparoscopic surgery, again, it can take you 1.5 to 2 hours. And if it is an open surgery, also it can take you 1.5 to 2 hours. And the recovery is, if you're had a laparoscopic surgery, your recovery will be very quick. If you've had open surgery, you need about 6 weeks to recover. What is the best exercise for fibroids? There is no exercise for fibroids to shrink your fibroids, but any surgery, after your surgery, definitely 8 weeks after your surgery, you need to exercise to get back into shape. Is it okay to leave fibroids alone? Yes, if it's not bothering you, if it is very small, leave them alone. At what stage should fibroids be removed? If it is troubling you, it should be removed. Do fibroids get worse with age? If it's growing bigger and bigger, it can get worse with age. After menopause, if you've had a small fibroid, fibroids tend to shrink after menopause, because you lose estrogen hormones in your body. Can you have normal pregnancy in the presence of a fibroids? Yes, I've delivered a lot of people, a lot of women with huge fibroids. In fact, they've had normal delivery also. Fibroids tend to grow during pregnancy, and you can have a normal pregnancy with the fibroid, provided the fibroid is not pressing on the lining of your uterus. If the fibroid is jutting right into the cavity of the uterus, it can make it difficult for you to get pregnant, or you might have miscarriages, recurrent miscarriages, or you might not even get pregnant, or you can lose that pregnancy. But in spite of all this, there are people who have a normal pregnancy, go complete term with a fibroid there, and even have a normal delivery. What are the signs you have mild fibroids and can be treated? I think I've discussed all this. Is fibroid PCOS? Fibroid is not PCOS. PCOS is polycystic ovarian syndrome, and fibroid is just a thickening of the muscle layer of your uterus. Very common in Asians and Africans, and most of the times, majority of the times, it is a benign swelling of the lining of muscle layer of your uterus. Any further questions? Hope I've answered everything. Hope I've been clear. We chose this topic today because we do see a lot of women with fibroids, especially Asians, and it can be easily treated provided we catch it at the correct time. I have an asymptomatic fibroid with 7 centimeters. Should it be removed? Asks Mrs. Lakshmi. And we need to know where exactly your fibroid is. As I told you, my receptionist had a fibroid which was almost the size of a football, but it was on a stalk. It was not troubling her in any way. It was not causing her any bleeding or any difficulty. So, but she was unmarried, and definitely it had to be removed. But it depends on where your fibroid is, how much problem it is causing you. So please contact your gynecologist. At least get it followed up every 6 months to see whether it is growing, whether it is causing you any problem. Then your gynecologist would be in a position to advise whether you need to get it treated, removed, and when would be the correct time to remove it, whether you would need a laparoscopic or an open surgery. Please contact your gynecologist. She will be the best judge. So I'm sure many of you will have many queries. You are most welcome to come and consult us at Apollo Spectra. We will be happy to, guide you whether you really need a surgery or not, whether you can be followed up. All the questions can be answered. I'm sure you'll have many more queries. The take-home message which I would like to give you is, anybody can have fibroids. Don't panic when you see a fibroid. You might go for just a general health checkup, like a master health checkup, and the ultrasound scan which they do as a routine might pick up small fibroid. And the immediate tendency is to panic. Oh my God, I've got a fibroid. So not all fibroids create problem. Not all fibroid need to be treated. So unless you have symptoms, unless it is causing you trouble, it can just be followed up with scans. So don't panic the moment you see the report saying fibroid. So if you see any report saying fibroid, do contact your gynecologist. They will guide you correctly whether, what needs to be done with your fibroid, whether it can be left alone or whether it needs to be treated. So the lady says it is on top of the uterus. See, on the just because it is on top of the uterus, it could be on a stalk or it could be coming from the substance of your uterus with a broad base. Unless we see you, Mrs. Lakshmi, it is difficult to, tell you on this live show whether you really need treatment or not. You need to be examined. You need to be seen with your scan reports and take a complete history from you, do a complete assessment, and then we will be able to guide you exactly whether you need to be treated or not. So thank you very much and namaste.